After the death of former Secretary of State and Joint Chiefs Chairman General Colin Powell because of COVID-19 complications, there are a lot of questions because he was fully vaccinated against the virus. Now people are wondering just how effective they are, if there still could be breakthrough infections. Well, morning anchor and health reporter Kirsten O'Connor is standing by now to Ask a Doctor.
Ask a Doctor is sponsored by Conviva Primary Care for Seniors.
We're told the vaccines are supposed to protect us, so Colin Powell's death has come as a shock, especially to those who already have questions about the vaccine. And I did some research among several different experts. The first thing to remember here is Powell was 84, and he did have several underlying medical conditions, including a rare blood cancer called multiple myeloma.
Multiple myeloma itself, a blood cancer, results in people potentially not mounting the same type of immune response as somebody who is otherwise healthy. And so there was a study published in July that found that patients with multiple myeloma, about 45% of them, only 45% of them, will mount an adequate immune response after vaccination. And so that's why this is the group that is extremely vulnerable. They are recommended to get a booster shot, but even with a booster, they may still not have as much protection in order to prevent from severe outcomes. And
so because of being immunocompromised, there's really no telling whether a booster shot would have protected him. But doctors say for most healthy people with normal immune responses, the booster shots are incredibly effective. In fact, the FDA could approve the mix and match use of COVID-19 vaccines as booster shots as early as today.
In the real world, all these kind of combinations or extra boosters are already happening. So I think it's a matter of some urgency.
Run, not walk, and get that booster vaccination. The vaccines continue to be absolutely fundamental to controlling this virus. Yes, they're not perfect. Not much in life is, but boy, these vaccines continue to be excellent.
And doctors also say it's still important because although we've seen a decrease in cases, a third wave of COVID-19 could be on the way. And now is not the time to let our guards down.
We'll see the surge in cases, but not as much of a surge in hospitalization and mortality because the vaccines are highly effective against hospitalization and mortality. This is a false sense of security, in my opinion. Cases are coming down, which is very good. We should celebrate and we should tell people, yes, you're doing a good job, but you need to maintain it. I need to stress that we can prevent it by vaccination and mask wearing.
And Dr. Makdad also stressed the importance of getting the booster shot. With immunity waning, the further away we are from people getting their original shots. He says that could also be a factor in whether or not we see another wave. We'll continue to follow the developments when it comes to booster shots, of course, right here on News 6 and on clickorlando.com. And I'll continue asking those questions to our local doctors.